Hey guys, I wanted to jump on today and talk to you a little bit about big toe mobility and how having a reduction or a limitation in your big toe mobility is going to lead to things like back pain, hip pain, knee pain, further up the chain. And so basically, when we look at big toe range of motion, we want to really see 45 to 60 degrees. So when we do that, we sort of want to see that 45 to 60 degrees here. And then it's not only important that we get that big toe range, but even more important is that once we have it, we actually have that ability to use it, so to lift off and to gain it. And so what happens with that is if you don't have that appropriate 45 to 60 degrees, when you go through things like gait, you end up compensating through the movement. And instead of toeing off properly, coming up, using our core, our bum, and our hamstrings and our calves, we end up cheating the movement and we skip over it. We never really get into hip extension, which means we then end up using our lower back. We can also, depending on how you're compensating, so if you don't have that range going up and over, what will happen is you'll either fall in and it'll start to create bunions in your feet, or you roll out and you start to get sort of like tightness through that outside of the calf. You get tightness through the hip. You can get knee pain. The other things that we see in clinic is opposite sacroiliac joints, so where your hip meets your lower back gets tight, and then lower back tightness through your QL on that same side. So we've gone through how to check it. Basically, you can just test it out on the floor. You can lift the toe up. If you're lacking through it, which I think most people are, we can start to go through some exercises to help work on it. So I like just grabbing our trusty golf ball, and I like to sort of roll through the bottom of the foot. And so when we're rolling through the bottom of the foot, the areas that we're kind of looking to do is, if we sort of look at the foot here, we've got a muscle called adductor hallucis, and that sort of like goes here and comes across and it forms like a figure of 7. So we just want to roll through sort of that medial arch, but then we also want to be rolling across underneath like the knuckle of the foot as well. So we're just going to roll forwards and back for about 30 seconds. Then we'll go through, we'll roll side to side for 30 seconds. And then once we started to loosen up a few of those tissues, what we're going to do, I'll go slide on so you can see it a bit better, is we're just going to push the toe onto the ball, and we're going to try and get that metatarsal head or the base of your big toe to sink into the floor while the ball pushes it up. And so then from there, over a course of like a minute, you should start to feel it relax. If you don't have good toe strength, it might flip out a few times, but that's a good exercise in itself. Then from there, once we've got that under control, we're going to practice. It's called reciprocal inhibition. So we're just going to basically push the toe into the ball for 5 seconds. Then we're going to try and lift the toe off the ball for 5 seconds. 1, 2, 3, 4, 5. Then we're going to push in. 1, 2, 3, 4, 5. Lift off. 1, 2, 3, 4, 5. So we start to get control of that big toe again. When we're doing that, we want to make sure that we're pushing the toe in, lifting the big toe off, so the other toes aren't lifting up. Or the other common thing you'll see is you want to sort of lift the whole foot up, or you're lifting the heel off in order to like get there. So they're the things we want to avoid. Then once we've gone through and we start to mobilize it, then we want to start to layer in some function. So starting off, double leg calf raises, just on a flat surface. If they feel good, you can go into single leg. Once we've done sort of 10 to 15 of those and they're comfortable, you can get through them, then we're going to go into some big toe biased calf raises. So we're just going to fold a towel up on sort of the edge of the towel. That's where we're going to put that knuckle of the big toe. And then from there, we can start to do our calf raises there. That's obviously going to place a bit more stress through that metatarsal head or the base of the big toe. So it's going to help with that extra range of motion. With this, you want to avoid sort of going out to the side too much, or sort of like outward deviation or inward deviation. You want to go straight up over it. Then once you've sort of gotten out 10 to 15 of those, then we can go into something like a plank body saw. So plank body saws, you can start off on double leg. If the single leg is too much to start off with, where we're just rocking forwards and back on our tippy toes. Once you've got that, you can then go into some single leg ones, which obviously are going to place a bit more pressure on that big toe. And then final stage is actually moving through it. So we'll go into like a bear crawl, where we go up onto our tippy toes here. From there, you can either just do some arm and leg lifts to get some movement, or the last one is you can actually add in some walking. And so there are a few nice little options for you to start looking at. A, measuring your big toe range of motion. B, working on some mobility drills. And then finally, stabilizing or strengthening up that big toe joint so that you can start to use it in a more functional way. I hope that gives you a little bit of insight into the big toe and how important it is. But alternatively, I hope it educates and empowers you to make some more decisions around how much work you want to do on your big toe moving forwards. If you have any questions, let us know in the comments below. We look forward to seeing you soon.